We have as our special guest today, Dr. Steve Rasner. Steve is in Cumberland County, New Jersey. Is that right, Steve?
Yes, I am.
You've all seen Steve. You know of his reputation. He runs the Rasner Institute. He teaches general dentists, and he actually teaches specialists as well. What life is like in the dental office and how you can create the practice of your dreams. Steve, welcome. Thanks for joining us today.
I'm really honored to be part of whatever you do. Thank you.
Thanks. So Steve and I have talked briefly, so let me just give you some background. He and I talked on the phone last night, and it was like he said something and check. I said something, check. So be prepared to see and hear some reinforcement of some of the ideas that you and I have discussed for so many years. Tell me, when you go into the office, and when you're thinking about your practice, thinking about your patients, thinking about your staff, what are some of the things that direct your thoughts?
Well, the first thing I want to say is anybody that takes time to listen or look at a podcast to learn a little bit more in dentistry, I'm a big fan of yours already, whoever's listening. I mean, that's not the everyday guy, you know, and so I try to give information when I do podcasts like this or Zoom meetings. I try to give you stuff that I really feel you can take back and make a change. So I don't just do this for any other reason but that. So when I say to you, and it sounds rah-rah even to me, that when I go in my office, I mean it. I don't walk in, because I walk in through the reception area. I don't walk in and get stressed out. I walk in and think, damn, I am lucky. These people all believe in me. And let me explain that. So maybe at the moment I walk in on a Monday, there's two people in hygiene, and maybe there's one or two on my schedule. I do a lot of sedation dentistry, Lee. So it's very common, I mean, every day. So it's very common that my patient will already be in some sort of sedated phase, but maybe there's a post-op check or something else going on. So there's 4 or 5 bodies of patients. And you know, this happens in your practice too, to the people listening. Every one of those people, every one of those patients that come to you made a decision. They made a decision to invest in you. They could have gone somewhere else. They made a decision to come to you. And on that particular day that I'm referring to, they blocked out their schedule. They told somebody. In my case, I got a ride if they're sedated. It's not like a little thing to me. After 40 years, it's still a big thing. And we all know about the morning meetings that we all have. My morning meeting's focused on this. And I think you should think about this. It's like a Broadway play to me. I mean, I know it sounds dramatic. I hate that. But, you know, the curtain goes up if we start at 9 o'clock. What are we doing that day to make people leave feeling good about the time they spent? Did they feel ever like was their clinical treatment superb? That's up to me. That's up to you. That's up to the hygiene team that you look after. Is it because they can get an average anywhere? You know, you don't have to be a fee-for-service practice like myself, but I certainly think it's something you should aspire to. And if you are that practice, that means these people are paying more to go out and network. We all know this. So it better be palpable. So what do I mean by that? I mean, I want a relationship-based practice for real, not just some fancy words, that they feel a connection. They trust us. They feel comfortable. We can do a little extra for them, like get them out on time, or can we see them a little early? Things, you're damn right. We're going to do almost everything and above. Just like I was always fascinated by the service of the Four Seasons hotel chain. It's a true story. So when I started speaking in 1998, I was so happy that I was valued for somebody to hear what I had to say, that I thought I was more than I actually was. I thought I was Tony Robbins. I mean, my early audiences were gigantic. My first crowd ever was 2,500 in Destin, Florida. And then I did a Las Vegas thing with 3,000 people, and I got a good response. And because that happened, I had already gone to, I don't wear, by the way, I don't wear fancy jewelry. I don't wear any jewelry. My car's 10 years old, but when I go away to stay somewhere, I pay money because I like the way I'm treated at the Ritz-Carlton or Four Seasons. And I went there so many times that I went to management. I used to go to the West Palm Beach one down by you. That was a very big landing spot of mine. And I asked them if there's any way I could interview members of their staff to see why they do what they do. You know what I mean by that? You know, when you get out of that car and you walk through the doors of a Four Seasons hotel, how do they know your name so well in a second? They're trained to do that, by the way. They have these little earpieces in their ear, and the guy that's taking out your suitcase is telling the guy at the door, it's Dr. Rasner. He's been here many times. I know the whole deal. So much to my surprise and shock, they gave me this little tag that I wore for a year. And if somebody wasn't engaged with something they had to do, they would give me 10 minutes. You know, I always wondered how they did what they did. Is it because they paid them so much? Is it because, what was it? And I found out a lot of things. They get enormous training. Enormous. They never stop training their people. That's number one. They don't get paid that much more than somebody at the Hilton, to be honest with you. But they get trained. And you know what else? They like working for the Four Seasons. They like that on their resume. And there's a good reason they like it, because it's a positive experience. So, well, how does this relate to us? I kind of look at my team as if we are that. I don't mean we have to be ultra fancy with marble in the bathrooms, because we don't have that. We have a very clean, beautiful office, looks like a spa, but it doesn't have any waterfalls in a waiting room, you know, and stuff like that. But the culture and the vibe, I'm positive, is something anyone would feel good about when they walk through the doors. And it's not by accident, you know, because sometimes it slips. You know, something as simple as somebody not acknowledging a patient that's walking down the hallway. That doesn't matter that the person walking past that patient is not even going to see them today. It could be my sterilization assistant. It could be the insurance girl who happened to be walking. I don't care who it is. I want you to look the patient in the eye. I want you to smile. Have a good day. Hey, good to see you today. I know and by the way, none of this means jack squat if your work sucks. I get that. That's all just a bunch of fluff, and they'll still leave you. If you're a GP like me and your crowns fall off all the time, or your fillings fall off, or whatever you do doesn't feel better than the other guys that you went to, then fluff. This isn't really fluff. It's part of being a special organization.
It isn't, but at the same time, you're setting a standard. Okay. And I'm assuming that the standard is coming from you. The staff is not treated that way because somebody else has done it. I'm not saying you're doing everything in the office in order to you're not micromanaging. I can't imagine you would be, but you are setting a standard for everyone, right?
Yeah. We're setting a standard. So I guess I got off track. The point I'm making is, when there was a time, Lee, I remember walking in, there would be, first of all, we saw many more patients a day 30 years ago, 25 years ago. And I do remember feeling stressed. And I do remember feeling, I don't even want to go through the front door because somebody's going to be mad at me for something. Maybe I was late last time. Maybe they had a discrepancy in their bill that I heard about. I don't know. I'm not saying, I want you guys to know, every day is not perfect. Sometimes I hear things that I can't imagine somebody doesn't know. That doesn't represent my brand. It works for me. I do, and I'm disappointed when it happens. But man, we only work 4 days a week, 8 hours a day. I can put this together that many hours a week, and so can my team. And the payoff and the reward is huge, from the type of outcomes we have, clinical outcomes that I'm proud of, to, the revenues it generates, to being able to afford the equipment and stuff. And it wasn't always like that. And I want you to know that. It doesn't cost a lot of money. It costs a lot of pay attention to stuff.
Let's talk about represent your brand a little bit. When people think of branding, they think of what? Insignia, the logo, whatever it is, the little statement below the logo. It's not that. The branding comes from you. So there was a time when you were fresh in practice, and a lot of our members are relatively young.
Good.
Where they kind of felt, and I'm sure they do, because I know how I felt when I was first in practice. You don't want to be in victim mode, but you are in victim mode because you have to satisfy everybody. You have to satisfy the referral source. You have to satisfy the patient.
Sure.
Sometimes you even have to satisfy the staff. And so rather than you're establishing the brand, it's like the brand is being imposed upon you by somebody or other people who may not have the same thought about brand that you have.
Sure.
How do you overcome that? Or do you overcome that? What did you do? Remember, let's go back. Yeah. Steve Rasner, 35 years ago.
Well, the number one thing that changed me I never was in a terrible place, because like I'm sure anybody listening to a podcast, some of you are probably in the gym right now or on your way home from work or whatever you're doing, you're already committed to CE. So CE changed me. I came out of Penn in 1980, and I didn't do as well in dental school as I would like to. The guys just seemed smarter than me. So I didn't have any post-grad opportunities. I had to go back to my hometown, which is Cumberland County. And I worked with my father, who was a mom and pop dentist. And I felt like I'd stayed back in school. That's what it felt. And, we all negotiate our feelings of different ways in life. I started taking CE. Back in 1980, I would find guys that I heard about. There was some guy out in Chicago who was famous on occlusion, Chagall or Chagrin, I can't remember his name. And I was incessant on calling these guys and saying, can I come out to your practice? And most of the time, I never heard back from them. But once in a while, I did. And that's how it started for me. And as soon as CE came of age, it became more of something you could participate in, especially hands-on. I started doing it. I flew from Philly to Seattle 17 times. 17 times. It was $5,000 a pop to work with Frank Spear and John Coys. There's nobody you could mention that I didn't do that with. And what happened really, if I think back about it, is I met other like-minded guys, which is part of being successful. So let me make something clear early in this podcast. Most business owners are limited by their own, I didn't say this, Tony Robbins did, but it's brilliant. By your own fears, the limits you put on yourself, and the stories you tell yourself of why you aren't where you want to be. It means you get in your own head. We all know that, right? And so the number one way to change that, particularly what you and I do, because being a dentist, let's be honest, most of us are not hospital-based. We don't run into 7 other dentists a day like physicians do. So it's very easy to stay in your own mind and not know other better ways to do anything that we do each day. Maybe you're lucky enough that you work with one other guy or two other guys. And that is fortunate for you, by the way. But when you go out of the office and you take CE, you're not only just taking CE, you're sitting next to another guy that probably thinks like you do. And then he might tell you about another place to go take more CE or how he does something at his office. It is so healthy for you that it's the number one thing I would tell you to do the second you get out of even perio school. I tell my young dentists that follow me, keep your credit card scores high and your credit card debt low. That means live under your means in this first 12 years if you can have that discipline. But the one place I would borrow money is to take CE. I wouldn't borrow it to buy a Porsche or something else, but I would do it to take CE because it sets the tone for everything. And that's what happened to me.
Yeah, it's interesting that I've got a Toyota that has a Toyota Avalon that has 130,000 miles on it.
Your car payment per month, I bet it's like zero, right? Like mine.
Right. I mean, so I can tell you, there are a couple of things that amaze me, and I know this is your interview, but I want to comment on at least what you've said. Number one, in taking the CE, once I found the doctor, I wanted to take everything I could from that doctor, because what the doctor presents at that first intro lecture is not what the doctor presents on day 7 or day 9 or day 10. Because he's presenting the nuggets at the beginning.
Sure.
We all are. Any of us who are out speaking. Mm-hmm. And then when we get into the real nitty gritty, it's not as interesting. We're not as interesting from the podium. We're not as interesting because we're really getting into the points where we're saying, all right, it's a stepwise progression. You got to do step 1 before you do step 2. And by the way, you've got to do step 1 this way in order to be able to even get to step 2. You don't get that until you've established a relationship with that doctor.
The best week any of your listeners ever had, I bet you, what I mean by that, by case acceptance, by, I don't know, feeling good about what you did that week. I can almost guarantee it was a week after you took a course.
Yeah.
Almost every time.
And you were cringing because you had to spend $10,000 for that course. By the time you're closing the office, and probably more than 10,000, and you're cringing, and you made that money back right away.
Yeah, man. Let me tell you something.
Of course, the staff was saying, I wonder what he's going to bring back and how we're going to have to change.
Right. Well, guess what? I took so much CE. I'll give you one example. I've taken more Mike Pico's courses than any doctor ever. That's embarrassing a little bit because I've taken many of them a couple times because that's me. I need to do stuff like that. Yeah. And the only reason I know that is because Mike Pico's, I want him to stop doing it, puts a list at a break of the guys that have taken the most courses, and he gives them a platinum. It means Jack, you know what. But I've taken exorbitant amount of courses, and not just with him, with everybody. And I can tell you, it set the pace for everything. For the guys I circled myself around, for how I thought, like, for example, getting paid up front. I know that's not exactly our topic right now, but I realized after many years that, a patient, and I don't mean to sound callous in any way, but when you are with a patient in that treatment room and you're about to make a commitment or a presentation to them, to be honest with you, either they can afford it or they can't. I mean, it's really just the truth. And if they can't, and I want to talk about this, what can we do? What's the line we'll draw to keep them in our nucleus of our practice? Because that's important for long-term success. So, and by the way, my line in the sand is healthy perio. I mean, let's be honest. You don't have to replace number 30 to live and be healthy. It'd be better if you did. You can actually have multiple missing teeth. You can have poor aesthetics. But there's no area, there's no arena where anybody can argue It's okay to have inflamed tissue. That's fine. Never. It's not fine. So, and we should talk a little bit at some point. We'll see how long they can take of me about my comprehensive care approach. But what I wanted to say, I got off the track. If you look up Cumberland County, New Jersey, and I get in trouble when I say this because I feel bad about it because I'm from there and I don't want to feel like I'm throwing stuff at them. It's almost worse than you can imagine in terms of economic growth. No one would ever go there. So I'm not talking to you from a suburb of Philly like Cherry Hill, or I don't know, a suburb like Atlanta, like Buckingham. No, I'm in a place where no one would really go to start a practice at this point. Yet, I have a fee for service practice that has astonishing numbers, even to me. Not for 1 or 2 years, for ever, especially the last 15 years. So think about it for a minute. Why? How's that consistently possible? How are people who can go to everyone else, to a myriad of any other dentist, they're as close as I am, pay less money? I don't know. For sure, why not? Why does it work? No, the short answer is because the principles I share, the principles that Lee shares with you, because I've read a lot of them. Be a great clinician, be a great communicator. I mean, could it be that simple? I hope you believe it is. If you stick to it and you have found sound protocols of how you do stuff, like how do you approach the new patient that comes to your office for the first time? How do you approach them on the phone? What are you branding? Like Lee asked that question 20 minutes ago. I guess I still haven't answered it. What are you branding? I brand trust and confidence. Yeah. Well, how do I brand that? Well, and how you market depends on where you are in the country. I'm in a rural area, so I can afford to go on radio. And I have a 60-second commercial that is astonishingly successful. I know because we track it. I would not tell you to do that if you're on. I look sometimes, as maybe you guys do, and guys will advertise implants for $700, including a healing cap or some crazy stuff in the New York Post. Or I don't know what the ORI, the return on investment, is for that. But, and by the way, let me just say this real quick. My email is my name. It's Dr. Rasner, RASNER at AOL.com. I'm sure Leo will put that up someplace for you. I will send you for free. I have no agenda. I'm not going to sell you anything. I do this like he does this because it does bring me a high level of satisfaction to think that I'm connecting with colleagues that aspire to excellence. It really does. Why else would we do this? Yeah. And so I'll send you blogs I've written. Branding. I have a marketing program that costs me 11 grand that consists of postcards and stuff like that. It says, send someone you love to someone you trust. It took a lot for me to develop that. So just put that out there.
Thank you.
Where are we?
The people who are in our group are all specialists. Mm-hmm. And they're concerned about the deterioration of the referral model.
Good point.
So you're a general dentist. Mm-hmm. So now look from your point of view at us.
Yeah.
And tell me how you look at that model and maybe where that model can or should go.
Well, let me be clear about something. I'm fortunate enough to be trained to do things I think I can do at a very, very high level. I think it's possible in life, not just in dentistry. I'm very clear that I'm not a periodontist, and I'm not trained, nor am I as good at many things that you guys do effortlessly. And a lot of you guys do things better than the other guy. So I know who you are. I have immense respect for the training. I always wanted to go back to school, and it just never happened. So kudos to you guys for what you are, because you really are a specialist. What would I do? I'll tell you what I would do if I was a periodontist. I'm really good at thinking like this way, by the way. I would start by this, and you got to make you, I'm talking to you right now on a Friday. I'm off. I like to be playing tennis, but I'd rather do this more. So you got to do what you want to do in life, and you got to work for it. Sorry to talk like an old guy, but that's what happens when you get old. It's just true.
Tell me about it.
I would nurture the GP perio relationships that were worth nurturing in your community. That's where I would start. And they're not all worth nurturing. So you got to do research. You got to look into, I don't know, maybe you're surrounded by 40 GPs, 100, I don't know where you're at. They're not all worth spending your time. You got to remember the Pareto principle, I think it's called. This was developed by this brilliant Italian guy that said that 80% of your productivity comes from 20% of the masses. So you don't even need to try to connect to all your GPs, because most of your referrals anyway are going to come from 20%. So that's fine. That's good for you. How would I do that? I would embrace the study club model. I don't know what Lee thinks about it. I haven't talked to him about it. Maybe I'm wrong. Maybe it's outdated. But if I was I know I would do this if I was a periodontist. I would try to start a monthly club for an hour. If it failed, so what? I would at least try it. And in that course, I would always enter the course without the thinking that I'll positively get all this guy's work. Which means you got to teach him stuff. And the first thing I would teach is, and I know you know this is true, we're way over our head with taking teeth out. I don't even know what happened to orthodontic extrusions and recreating a furrow and the Danny Melker thing of barreling frications. Come on, man. A tooth is the best thing in their mouth, not an implant, if it's restorable. And many are taken out, and you know this, that are restorable. So I don't know what your thoughts are. My first thought would be teaching them. That would be my first couple lectures. Do you know that this exists? Or bring in somebody to teach them that. I would. That's the first thing I would do. Well, the first thing I would do is I would research. I wouldn't do it. I would pay somebody on my team, and this is exactly Steve Rasner. I'd say, I want you to find me the top 20 GPs that you think, save me the work, give me a summary of why they're the best. And I would look for the most expensive. I wouldn't look for the guy that advertises, of course you're not, it's $600 crowns. Or there's a guy up by me that he made his legacy by being open all night. He opens from 8 o'clock at night till 8 o'clock in the morning. I guess, I mean, it's mean for me to say this, but if you really had great skill, is that what you would do? I don't think so. So competence, trust, and confidence of the patient in you trumps anything else. It trumps being open all night. In other words, convenience. I'm definitely not convenient. You can get to me as a patient from 9 to 4 o'clock or something. It's absurd. It wasn't always like that, by the way. And when you start, you got to do whatever you got to do to let the community know that you exist. So maybe in the beginning, you do have to open up at night. And you have to work some Fridays. Whatever I had to do, I would do. Because you put too much into this to not do that at this point, right? So I would nurture those relationships. I would get on the phone. I didn't tell you this, but I got very specific. I get very specific with what a relationship-based practice means. For example, we do something every day because I'm prompted to do it, because my team knows I want them to prompt me. So on my desk every single day will be a note, call Mrs. Smith, just got out of the hospital. I don't even remember who Mrs. Smith is at that moment. But I know she just had an operation on her bladder because somebody told me that. And send a card that's in front of me to sign. Every day we do one thing. That's 4 times a week, 16 times a month, to create that relationship thing going on in my community. Man, when you do that for several years, it's impactful. So it's a phone call, it's a card, sometimes it's a tiny gift. And I'm prompted by the team. Well, I would do that if I was a periodontist with my referral source. You have to. You got to at least try. You know, I would make those calls. You know what most people, I'll tell you what they used to do. What they used to do and what orthodontists did, and you know, this is the shtick. They make that one trip to your office when they're starting and they schedule a lunch. That's not a relationship. That's a start. That's okay. You got to like continue it, you know, monthly. Make calls. How's your practice doing? Anything I can do? I mean it. That's what I would do.
Okay. I'm going to push back a little bit because that's what I do. So I'm going to push back a little bit on what you just said.
Okay.
Because there are many who are here, who are listening right now, who've said, you know, I appreciate that. And I've done that to the greatest ability that I have. And I'll talk to you personally. You know, I had a very large study club. And it got to the point where I said, all right, I'm willing to invest only a certain amount of time and effort into that study club. I'm only willing to invest a certain amount of effort in order to be able to get some kind of return. And I totally agree with you that education for education's sake is there and it's important. But also we're investing resources, not just money, but time, in order to be able to accomplish a result. The result is to have a practice that's going to sustain me, sustain my family, and I'll be able to retire on.
Yeah.
And I'm assuming, just based on what I know about your surgical skills, that you don't have a continuous relationship with a periodontist in your community, do you?
Yeah, it's interesting. I don't mind being, I am totally Peyton with everything because I never want to pretend like I have all the answers about everything, even though I've had a lot of success. I surely don't. The periodontist in my community for years that just retired, I did not have a good relationship with for the obvious reasons that we're all familiar with. He never reached out. If he had reached out, I don't know what would have happened. I'm going to be honest. I wouldn't have stopped doing things I do. Sorry. You have the ability to edit?
I can edit anything I want. Yes. I have Camtasia. It's okay. This is going to be more entertaining anyway. So what the heck?
Fine with me. But this, and this is interesting why I'm telling you this. So he got replaced last year by a new periodontist. And I thought, you know what? I'd like to have a different approach because I don't have that approach with my oral surgeon office. We have a good relationship. I can pick up the phone and I do a lot of stuff that they do. And for whatever reason, maybe over the years, they're younger guys. I don't know what it was. And by the way, I would refer the heck more to both of them if they did more. For example, sinus lifts, horizontal, vertical GPR. I would love it to do that. But, you know, not everybody, as I said this in the beginning, even as a periodontist, has the same interests. So not everybody's interested in doing that stuff. Right. And the guys in my community are very, very good at what they do. The surgeons are impeccable, the oral surgeons. But no, to answer your question, to put it right out there, it has not been the best relationship. Even with the new guy, I've tried. I sent him a case. I put that on him at this point. I sent him a case early on, and I reached out on the phone twice. I don't know what else I can do. I've even looked outside of my area, which, by the way, I do. Yeah. I send the guys, I'm sure that a lot of your guys have heard of in Philadelphia. So that's what I've done. Salama is near us. So
all right, so we look at that, and relationships will deteriorate for various reasons, or relationships will never get started, and that gets back to our talking about being a great communicator and spending time, and actually heartfelt time with that referral source. But still, if a periodontist is looking in his, because most of our people are periodontists on this podcast. We have one oral surgeon who you've already mentioned, Mike Pico is a member of our group, and a few prosthodontists. So as we're looking from our hearts and saying, in whatever way, I've done as well as I possibly can, and still I'm not able to sustain myself in the way that I want to,
then I know what I would do.
Then I'm going in the direction of independent marketing and becoming a primary care periodontal practice, if you will, so that you can establish your relationships that way, where, all right, I'll send to you, you send to me, and it isn't that I'm just dependent upon you to give me patients. What do you think?
Let me say this about that. I'm so happy you brought that up. A lot of you guys don't know, but I spoke at the NAS meeting, which I alluded to earlier. And Lee you weren't there, right?
No.
Okay. So I didn't even know his thoughts on a lot of things. I actually cited a couple of his slides because I like the way he thinks. I told them in that program, because it was an interesting title. It was called what? Can I say the title?
Please.
Is something around, it was centered around, well, let me see if I have it. Wait a minute, it's really interesting. Yeah, I got it. It was called Succeeding in Periodontics in the Current Climate of I Can Do It All, Super GPs, and Carpetbaggers. That is what I had to speak about on that topic.
I know where you got the term carpetbaggers from.
I know you do. I don't even talk about it, but I'm sure you do.
Sure.
And you know what? You guys are dead on. It's true. It sounds a little self-serving for me to say this, but even spending the little time we're spending here, I'm pretty sure it comes across that I'm truthful. And a lot of GPs do other specialty procedures, take teeth out, bone grafting, implant stuff. I don't think GPs are nearly as good at regeneration around teeth on any level. That's the absolute truth. I really want to just put that out there. I've been trained a lot. You know who trained me? There was a 3-year program at Penn where my chair side assistant was Jay Siebert and Walter Cohen. And I got to bring patients because I lived right next to Philly. If you came in from California for the 3-year course, they dropped the program and never finished because the local periodontists were angry. I don't blame them. I didn't understand why they left the course to begin with, but I was happy about it, to be honest with you. But so my point is I think the outcome here about what I'm about to tell you will tie back into what I just said. Just stay with me.
Okay.
I would market directly to the public. I would absolutely market. I don't know how to say this, and I'm not saying it. I don't even care if my local fellow GPs, which I do a lot of podcasts for GPs, see this because I believe it. If I was a periodontist or oral surgeon, I would market directly to the public, and so be it. I'll put it like that. Okay, because either you're going to establish a network referral between you and the other good GPs. There's going to be GPs that think that are eventually going to get in trouble with their clinical work, and they're going to want your help. And if that's all they ever come to you for, just like a bad patient, then say no, refer them to somebody else. But if you get a guy that's has an epiphany, he wants to make a change, he understands he can't do connective tissue grafts or even implants as well as you, he will come around. And all you can do is take care of yourself. And I'm going to tell you the number one way I would market to the public. And I haven't said this to you, Lee. And so I've done a lot of speaking opportunities for other periodontists and oral surgeons in the United States over my career. In other words, they have me come in to speak to the referral groups. You need, when you write to me, if you do, ask me for my internal oral sedation cocktail that I use. It wasn't invented by me. I've been using it for 25 years. Just let me finish real quick. It consists of Benadryl, Atarax, and Triazolam. And I will tell you, I was turned on to it by a prosthodontist 30 years ago at the Mission Institute. And it's astonishing to me that it didn't catch on to the profession. It is superbly more effective, superior, than just Triazolam. And here's why I'm telling you this. I would market that because a lot of people are not having, some people do not have periodontal surgery or periodontal therapy because they're scared. I can tell you right now. This fear comes from needles. It comes from the stuff you do. It comes from the whole thing, the smell, the sound. It's variable. I am an expert in oral sedation, I want to tell you. And I know this market. And we market no-cost sedation. The pills cost $8 for those 3 pills. Of course, nitrous oxide, which is the 4th component to it. Yes, that costs money. The returns are so astounding of the number of people that come out because you offer that. Please just try it. I have a rule in life. It's called the 120-day rule. It means if you hear an idea from a speaker, you're not sure it's going to work, it's not going to break the bank for you, try it for 3 or 4 months. If I'm wrong, what did you lose? So I would market it internally. I'd let my staff know that that's what we're doing. And now you need a permit if you don't have an IV sedation permit. If you have that, obviously it covers it. I would do that over IV. Absolutely. I mean, unless you're doing a ramus graft or have a really tough patient, something like that. It is a marketing gem because they're totally controlled, which they like to be, but they're out of it. So does it sound like a contradiction? It's not. It's the best. And by the way, it's good for you. It's a wonderful way to work. The lights are out, the patient's snoring, they're monitored. If they have to go to the bathroom, their blood pressure goes up, they get up, they never remember it. I've never had one incident, not somebody stumbling in the hallway, nothing in 25 years. And I've counted roughly, and when I use numbers, I don't exaggerate, I'm sure it's in excess of 10,000 cases. For not to have one incident, I've had an incident having to pack cord. I mean, I had called 911 because I packed cord with too much epinephrine. This is an oral sedation protocol. Yeah. And I would market that or whatever. Market that you have a relationship-based practice. And I can send you examples, but obviously you're not going to use those words because that doesn't resonate with the public. But I would tell you, I know how to market these concepts, and that's what you should do. How do you market? Depends where you're at. Radio, hard paper, throwaways. It's important. I can tell you what won't work. Free or the implication of you're less is the worst idea you could ever think of in dentistry. That doesn't work. Come in for a consult for whatever, a discounted price, forget about it. Don't ever do that. Sorry, I don't know where I was.
That's good. Just so you know, one of the biggest successes that we had, because I believe that you're going to hear from me just like we hear from you, is that the moment we brought our total exam fee down to $79, which include a CT scan, all of a sudden, the consultation fee was not the barrier to the person finding out who I was. And it made a tremendous difference for us in the number of people we were able to get in and the number of people that we were able to successfully schedule treatment for at, at what we consider to be very good fees, no matter who you are. So understand, Steve and I may differ in that regard, but there is a certain mindset that we all have. And as Steve said, you test it for 120 days and see what works for you. I found, and so that may be one difference that you and I have, which is fine.
Yeah. Yeah. Well, let me say this, and let's go back for a second.
Yeah.
I want you to think about this. Here's why oral sedation is so effective. I mean, why aren't I here telling you about focus on laser perio, or even the most beautiful root coverage you've ever achieved? I don't market that either as a GP. Why not? Because people don't talk about that so much. Number one, they don't even want to tell anybody they had periodontal surgery because it implies that they have periodontal something wrong with them.
Right.
Same thing would have been your case. People want to think that they lost weight or something's different or they look useful. They don't want to brag about the fact they spent $25,000 to get a facelift or something, or a tooth smile reconstruction. But guess what? There's nothing wrong with telling people, oh my God, I found the best doctor ever. He works on you and you sleep. You don't even remember going there, and he doesn't hurt. His name's Dr. Sheldon. Oh, what's he do? Well, he's a periodontist. That vibe gets out in your community. It's not going to happen in 6 weeks, but I've been doing sedation dentistry for 25 years. It will happen in 12 months. Well, what does that mean? You will get people referred to you by other people you work on because you offer sedation. We even sedate people for scaling and root planing.
Yeah, and it's absolutely true. Whenever you're marketing to the greatest need. In other words, you're going out, particularly if you're doing some kind of mass marketing. And Steve, just so you know, we do a magazine. We do a magazine with Gilead Dental Marketing. We've been doing it for years. That's our primary. Okay, and worked very well for us. And in our area, we do fine with Google AdWords tied into our website. And in some in communities that are population dense, web marketing doesn't work nearly as well because you're communicating, because you're in competition with the $599 implant. I mean, you just can't do it. So there are other ways of doing it. But when we did direct-to-patient marketing, when we first did that, and understand that we're starting off as a referral practice, and then I started doing direct-to-patient marketing, well into my career, 25 years into my career, to discover what's out there. There were a lot of other reasons.
Direct marketing to the public, correct?
Direct marketing to the public. And what you find out is that there's a totally different public who is coming into you now. And most of those people are people who had opted out of the system because they were mistreated in some way. And one of the ways you're mistreated is when you're told, no, you can't be sedated for this procedure. There's a lot of people come in to us simply because of fear. And I know that we don't all want to see fearful patients, but you do level the playing field when you do sedation. And that becomes a big part of our practice.
The sedation patient that you're going to attract has likely not kept current care. He needed perio 10 years ago. And a lot of those patients are going to end up having, for you guys, terminal dentitions. And so that's the patient you're going to inherit. And so the explosion of the payback for not even charging. I don't want to charge. I would pay them to take it. That's how nice it makes my clinical life. True. To be honest with you. So you really do need to ask me about this and try it out in your office. If you don't have an IV sedation, try it out on your wife or something. I don't know if that's even appropriate to say. I'm telling you, it works every time. Obviously, there's a percentage, I don't know what the percentage is, of patients that require IV sedation. They're frenetic in your operatory, they're crying and stuff like this. By the way, if you don't mind, I don't know whether this is something you guys are interested in, but I want to take 1 minute and talk about my approach to the terminal dentition patient. Does that sound decent? Or I have many other things to talk about.
By all means, let's talk about terminal dentition caries and terminal dentition periodontal disease.
Periodontal,
Okay.
or they're just in big trouble. And so we know that they're going to either a denture or implant retained prostheses.
Okay.
Maybe this isn't profound, but I never heard anybody else talk about it. So as soon as I know that is what's happening, and by the way, there's a process that occurs in my office from that very first phone call that was developed over my career because of mistakes we made. So for example, I experienced, like maybe you have, the hygiene coming to me saying, they don't want me to take any x-rays. They just want this one tooth pulled or something like that. They don't want you to examine their whole mouth. Well, that never happens because they're told in a protocol that we have, which I can give you at the initial phone call, of what is going to happen. Let me tell you how the first visit's going to work. Okay. I mean, that's what happens in plastic surgeon's office. It certainly happens when you have outpatient procedures in a hospital. Why wouldn't you have that rep? You know, you got to remember something. We share something, you and I. We have 8 hours a day to use these two things. That's all we got. And some of those hours are spent with new patients. And I don't want to be anal retentive about it, but there's no room at this stage of my career or yours to blow off an hour because the patient didn't understand what was going to happen. I would rather them never come in. I'm dead serious. So once they come in, there is a thing happening from the front desk person that knows they're coming in. It says, you must be Mrs. Robbins. Hey, welcome to the office. I mean, you ever been in an office yourself, any of you, were a physician's office or a lawyer or something, and you don't even know if somebody's working at the front desk.
Yep.
And I'm okay personally for about 4 minutes, and then you lose me. You lose me, you ruin me. So no, that's part of it. That's not fluff. That's representing your brand that's about to pay off in an hour down the hallway. Then there's another, by the way, they are interviewed on the phone by the new patient coordinator. And I can give you all this. So I have a sense what's going on. I know it's a little different for you guys. Maybe that call would be, I've been to my GP, I'm frustrated. All of a sudden he told me I got these things called pockets and, blah, 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 blah. Or in my case, it might be my crown keeps coming out and et cetera. And Michelle will ask, can you mind telling me a couple things about you? And we're getting a sense. And guess what? When they come back into the office, remember, I'm going back to the terminal dentition in a minute. They're having a second interview in the office for 5 minutes. Why? Well, number one, we try to get the spouse to come to that first visit. And we have about a 70%, and I don't mean 50, 70% success rate. That is extraordinary.
It's so important. It is so important.
Of course it is. We're not talking about $2,000.
We're talking about major treatment here.
Yes.
A major decision. We're doing a complete examination in every patient. And the idea, by the way, the people who are 30 years old, you still do the complete examination. Doesn't mean they need major treatment. Maybe they need a cleaning and that's it. But everybody, I'm sure, Steve, you agree with me. Everybody's treated the same. It's the complete examination.
Absolutely is. So they come in and there's another quick interview. And now the interview is with their spouse 70% of the time. And guess what? I think I've studied this and done it long enough that I think the reason this happens is because a lot of people are like in denial. So over the phone, they'll minimize the situation. Some won't, some will tell you what it is, but a lot of won't. So I want to be as prepared as I can be when I walk into that room as to what I'm walking into. Are they angry? Some people are angry. Does the spouse, want to shoot me because He's scared. She senses a money issue here. That came up because I want as much information. And when somebody's in person, they tell you different things. Sometimes they'll tell us on the phone, I have bad taste in my mouth, and they walk in and it's perio buzzard breath that you can see from 4 feet away. And they start breaking down and crying about fear that they never even mentioned on the telephone. So quick interview, back to the operatory, x-rays taken because that's already been approved. I don't care if they had them done a month ago. I'm taking my own. By the way, I'll eat the x-rays if I have to. I don't care about that. Meaning I'll do it for nothing. They've been charted. We don't ever probe on the first visit on purpose at that stage because it's not comfortable. And I can get a great sense, unless it's a borderline case, of where this is going anyway by the radiographs and by examination. So when I walk into the terminal dentition patient, and you need for me to send you what I call the first 2 minutes, like what's literally happening. Is this going too long? Should I keep talking?
No, we're good. We're good.
When I walk in, what's going down in the first? Let me just tell you what's going down. I walk in like I have all the time in the world because I kind of do. I make time for it. Even if I don't get the case, it's fine. I want them to leave with a good taste in their mouth. And you'll love this, guys. You should try this. I'll walk in. Of course, I'll say something like, hey, so how did you guys find us? So it's the patient in a chair and the significant other in a nice, comfy chair on wheels that I bought years ago in each operatory. And I like to ask them how they found me, because maybe they found me because their sister comes to me. And it immediately invokes conversation, which will influence your presentation. It makes you feel confident, doesn't it? And that's part of being successful. And then I'll say this, I say, listen, I know there's a lot of places you could go today, and I know it's a very nerve-wracking thing to go to a new dentist. I acknowledge that, because it is. I'll say, I want to tell you who we are, who I am. So I'm going to tell you who I'm not right away. I am not a salesman. I'm not talking you into anything. That is not what I'm here for. That's how I start. I do. On a big case, I know it's going to be big. I'll say, the mouth is unlike any other part of your body, because it'd be better if I was a dermatologist. I'll have different ways of saying this, because if you have a big rash, you can see it. You want to treat it, but that's not what dentists do. We treat things that you can't even feel, particularly gum disease and bone loss and stuff. It generally doesn't hurt with such gravity that you know it. So I can tell you this, I'm been a lifetime student of CE in my industry, and I've learned a lot of cool things. But the thing I learned the most is called what to do when, because you need me to know what to do when. That means you're sitting in my chair right now. You wouldn't be here if you had a satisfied result somewhere else. How do I know what to tell you? I would do this if I was a periodontist. And listen, I'll tell you what I would do. I'm going to look at 5 areas of your mouth. And I'm going to go ahead and tell them the 5. By the way, the first one is their periodontal health. Because I say that sets the tone for everything. Of course, you guys know this is right. And nobody's going to want to give you a fancy smile. I'm a successful dentist, or any businessman is a successful chameleon. You can adapt to the personality of the person you're talking to. You do it in life anyway. You do it all day long. So I'm adapting. If it's a doctor, I'll be speaking maybe a little different. I don't have to practice it. And I'll tell them the 5 areas of how I see them. And then I'll proceed. And it's too much to tell you in the scope of Lee's podcast today. Yeah. But with the terminal dentition patient, I will have next to me a denture, not a model, a real denture on a mounted model that's complete, an upper and a lower. And I'll say, listen, one of your options is a denture. I'm sure you have friends that have dentures. Here's a denture. This is real. And I'm not degrading, I'm educational. They see me take it off the model. I hold the model in front of them on a mounted articulator, and it's a edentulous maxilla. I'll say, I want you to look at this. How well this stays, this happened yesterday, by the way. How well this stays in your mouth depends on the shape of this palate. And this is what goes on it. And I put it in her hand, not to convince them, not to trick them. I want them to know. I said, a lot of patients can wear an upper, but I want you to think about something right now. When you're eating potato chips or ice cream or anything that invokes taste, part of what you're picturing in your mind right now is what you're feeling on the roof of your mouth. And this covers the roof of your mouth. And I'm not telling you, look, you're at the end of the day, you're going to do what fits in your life financially. I get it. But I want you to know what you're getting into. And that's why I'm talking to you like this. I said, this is a lower denture, so it's the other half of the articulator. I said, I haven't made a lower denture in a long, long time that wasn't supported by something called implants. And this is why. And I go in to explain about the tongue and everything like that. And I said, look, there's no doubt in my mind that if it fits in your world, that's how I say things. And I'll say financially. It's got to fit in your world. This can't be, oh my God, bought this thing. No, it's not, it can't be like that. You really, really have to want this. And if you're interested in that, I'm going to give you some options. And that's I call it 3D communication. Well, the whole thing's communication, if you think about it. Everything we're talking about. How you deal with your staff. Lee, if you don't mind, I want to give them one more tidbit. I know you got to get rid of me. Here's a great tidbit. You'll love this. Slow down. Add 30 minutes to whatever you do all day long. Because here's what's going to happen. The obvious thing is you're going to have more time, but it's going to make you happier. And you're going to have a little more time to make better decisions. The number one mistake that dentists make, and I would think this applies to periodontist, is you have a lack of time. You feel rushed. You got somebody else coming up in the next room and you're behind. Try that for 3 months. You also have more time to communicate with your staff. You won't make less money. You'll make more money. I'm positive of it. And besides, even if you don't make more money, but you're happier, really, you can't base your success on having to work real hard at what you and I do. If you structure your fees right, you commit a lifetime to CE, so you are the man or the woman, and everything else falls into place. And I know it sounds too simple, but remember what I said. I'm not here selling you anything. I don't even have an institute of training you management-wise. I have an institute, but nothing you guys would be interested in, or most of you. The days of selling my books and tapes are over. That used to be a thing. So I'm just telling you the truth. All you got to do is change your behavior and then step back and see, is it making a difference? And maybe you need to get some refinement on what I'm telling you to do or what you're hearing from others. That's it.
It's good, Steve. Give us the email address again.
My name, DrRasner @AOL.com.
Steve Rasner, what a fascinating hour. Thank you for reaching out and for spending the time with us today. For those of your members, all of those materials are going to be attached to this email. Those of you who aren't members, why not? But in case you're not members, you can contact Steve. You can contact me, and we'll get those materials out to you. Okay, Steve, thanks a lot.
My pleasure. Thank you for having me.